Yeah, let's start with the alphabet. Section A is general government, and they're back meeting. So I'm not sure exactly where they are right now. We can talk about some of the stuff that they did that was really good. Section B, get to that later. Section C, Democrats really held the line on conservation, recognizing that it's a part of our heritage, our outdoor heritage, to have access to public lands and to be able to fish and hunt and recreate in outdoors. And so Democrats held the line on making sure that conservation districts were funded. And, you know, Democrats have been there on these issues. We've been there for decades, and we've been fighting hard for a long time. And we made some headway working well with the Republicans in a bipartisan manner, but don't forget that we've spearheaded these issues. We want to be good stewards of the land. And then Section D, like I said, is still meeting. And Section E, education, I talked a little bit about that. I have to go back to, F. F is an interesting one.
So just, I feel like I'm struggling still to figure out which letters go to which names.
I'm so sorry.
Which is a dumb thing, but I suspect I might not be alone.
Yeah.
I'm sorry.
Let's roll through them.
I've got like half of them.
Yeah.
I'm sorry.
No.
I
You should have
apologize.
started with a pop quiz.
And we can flush through this in questions
I
too.
know that's not a question that's worth your time, but it would help me.
Well,
No,
in
no.
terms of-
So Section A
yeah.
is general government.
Right.
Yeah.
Section B is health and human services. Section C is natural resources. Section D is corrections. Section E is education, and Section F is long-range planning.
I remember half of
We'll
Okay.
do it again.
Okay.
C also includes highways and transportation, which is kind of.
Oh, right,
that.
yeah.
Yeah,
That
natural
state
resources.
agency nobody ever talks about. Yeah, it spends billions and billions.
Okay, should I go on? Yeah. So Section F is an interesting one, and I haven't really paid attention to it in the past, but this year it really caught my attention, and I'll tell you a couple of reasons why. Senator Janet Ellis has championed the issue of cleaning up the lead in schools. And what happened in Section F is that she worked with the committee really hard, and they recognized the value of children having access to clean water. So they had planned to put some money into, I believe it was House Bill 5, to go ahead and do the remediation for lead in the schools. And in spite of all of her hard work, the motion died. There was bipartisan support for it, but, you know, we have the minority, and so the Republicans ended up killing that. And I guess, you know, what I see are themes about Democrats support vulnerable populations, everybody knows that, but we really support babies and children and mamas and people with disabilities, and here's an example of that. Lead really impacts the youngest of our children, and it creates these long-term diseases, including brain damage. And so that's why Senator Janet Ellis was committed to it, and why we are committed, and we'll continue to try to get that accomplished. And then at this point, I'd like to say all of these issues and our priorities intersect. If we don't take care of children and make sure they have in schools where they should be safe, don't have access to clean water, and the access they do have, the access of water that they do have is damaging to their health and well-being long-term, then we're going to see that bubble up over in Section B. And Section B is where the Republicans really hit us hard. So, and Section F had one other piece, and I'm sure you all read about it. Maybe somebody here reported about that. Representative Paul Tuss moved an amendment to take out the funding for the behavioral health facilities, the build of the behavioral health facilities, mainly because we're in the dark. And if we're in the dark, the public is definitely in the dark about their plans for that. 113 million, it's about $1 million a bed. I mean, come on, we need more information to be responsible with money, the taxpayers' money. And so Representative Paul Tuss had a motion to pull that out. What happened is, again, it was bipartisan, but then the Republicans voted against his motion, so it's in there.
So to be clear, you support putting money into the mental health system, but you just want more information from the administration than a large pot of money that's $1 million a bed, and trust us, we'll do good things with it.
I would say that's a good summary, and I'd also say it's a slush fund. I mean, we appropriate money, the executive doesn't. And so before we support something like that, because we support the continuum of care from the very first call for suicide prevention in the community to when people need to go in for an emergency or a crisis. So there's that. And then
Representative, may I ask a follow-up about that?
sure.
About the 113 million fund before we move on to other things. I can also wait if you'd like to finish and then ask questions at the end.
All right, I don't care.
I'm flexible, I'm nimble. Let's go.
So I think that there was also a motion from Representative Fitzpatrick to amend that 113 million allocation quite a bit. I can't remember all of the pieces of it, but clearly there's also some degree of Republican pushback to, as you say, kind of lack of specifics around that allocation. Will you continue to fight that pot of money in House Bill 2, or when the appropriations process continues, and do you think that with Republican support, you can effectively strip that out of the budget by the end of the session? Is that the goal?
To be clear, I'm not fighting anything. Democrats aren't fighting against that funding. What we're standing up for is transparency and accountability for taxpayer money. We don't have it at this time. And so it's not a matter of a philosophy or a fight. It's a matter of the governor and the Republicans need to come to the table and let us know if they have a plan, because this is backwards way of doing things. You don't usually vote for a slush fund for them to do whatever they want with and then come back and tell us what they did. It's the opposite.
So if there's I think a policy bill perhaps being brought by Representative Keenan to bring an oversight committee to that fund, would you support that?
Well, that's hypothetical, and I don't have an opinion on something until I see it in front of me.
Yeah, I mean, the point here, I think, is it's a stunning lack of detail for a big amount of money. And we just need more detail from the department and from the governor's office on what they plan to do with a total of 300 million, I think.
Well, more than that.
Yeah,
Like hundreds of millions, and it's reckless.
Yeah.
It'd be so irresponsible of us to not make sure that we know what we're voting for. Yeah.
If it was similar to the ARPA committees, the governor ultimately retained all the decision-making authority on that, so those committees were in essence advisory, and I don't think at least the Democrats are willing to give our authority and responsibility away to become advisory when it comes to appropriating money.
Mm-hmm. So I guess just to nail it down a little bit, if there's not a satisfactory level of oversight for that allocation, is it correct that Democrats will not support including that in the final budget, that allocation for building new facilities?
Yeah, I mean, we have to see details on it.
And oversight in the interim, like the minority leader said, we have no authority to take action in the interim.
There's been, I mean, a theme, I think I've talked to you guys about this before, but there's a theme, and I want you to get to Section B for sure, just the overview on it, but there's been a theme of consolidating power in the executive branch this session that is concerning, considering separation of powers. And so, we're watching that as it comes through red tape initiative, sort of flagged bills, and we're watching it here with just a lack of detail on what money will be spent on once we leave in April.
So in terms of like a solution there, would you support something that structurally looks pretty similar to the ARPA commissions, or does that not go far enough, or like what do you want?
Well, that's not even, see, there's no bill for us to look at.
Yeah.
And so that's hard.
If you were writing a bill, what would you put in it?
Oh, I'm not. So, no. We really focus, let's talk about Section B. Let's get back to Section B.
We can wrap back around though, Dietrich,
Okay.
because I
Yeah.
think it's a fair question.
So in Section B in general, what happened is Democrats moved motions to fully fund the provider rates, recognizing that people in their twilight years are being ripped out of their homes and communities and sent across the state and moved sometimes multiple times, and that is senior citizens while nursing homes closed down. So Senator Chris Pope moved the motion to fully fund provider services. The Republicans voted no, and then they came back with a motion to not fully fund providers. And that's where we get into, there's community providers, and they are an important piece of the continuum of care. People want to live in their homes and their communities first. And it's silly to say, okay, we'll fund you, but leave a big gap, like 15%, in some cases more. What business runs on a 15% loss? And I just got an email from the Western Montana Mental Health Center, and they are going to eliminate 31 voluntary and involuntary community mental health crisis stabilization beds, or roughly 65% of capacity for the state. Those are gone. So this is essential that we take care of this issue, and Democrats supported it, Republicans opposed it. Then I'm going to go into one more, and then I'm finished. Again, the theme is Democrats support working men and women and their children and families. And we do. And you can see it in this budget. The budget is a statement of our values. It really is. The governor, in his budget, had a proposal for postpartum Medicaid coverage for up to 12 months. And that's really important in a number of ways. One, let's think about this. It's under $1 million a year. Contrast that with $180 million tax cut for the highest income earners in the state. Under $1 million. So there's no good reason financially not to support it. But it's tragic and unnecessary, the consequences. Montana is the 6th highest state in the nation for maternal death. The number one cause of death in postpartum is a combination of overdose and suicide. The peak incidence of self-harm and suicide is 8 to 12 months. Women with these issues present at their primary health care provider more than anywhere else. So put that all in your heads and think about this. The Republicans, after they killed the motion to provide health care through Medicaid for women 12 months out of the birth of the child, they presented a motion, and it passed without the Democrats' support. The motion was to have 6 months postpartum coverage and to cover behavioral health, substance use disorder, and mental health services only. So they cut the proposal in half, and they restricted it to those services. Why is that important? Again, because the number one cause of death for women postpartum is suicide and overdose. But those incidents happen at the highest rate at 8 months, not 6 months. I mean, that is such a tragic situation. And we support children after they're born, and Democrats support these new mamas. The Republicans don't, according to their vote. And so with that, I'm finished.
Questions?
So
Mark?
another one about Section B and provider rates. I know you guys didn't have the average rate increase compared to current rates on your decision package when you were voting on those, and so that was hard. But the department has said that the Section B executive action impact by the end of fiscal year 2025 would get providers across every category up to mid or high 90% of the benchmark rates by the end of that fiscal year. That's pretty impressive compared to the executive's request. The executive's request would have gotten quite a bigger range, some in the 70% of benchmark rates, some in the 80%. But it looks like the Section B action will have quite a significant impact on provider types. Why is that insufficient? Why is 100% so important?
So Democrats have a bill, and the bill is to fully fund the provider rates. And it's not good enough. That is not good enough. It's not good enough to go part of the way. And to compare it to the governor's budget is a false comparison. I'm sorry, but his is way down here and theirs is higher, but it doesn't get to 100%. And don't forget that study was conducted based on 2019. We are now in 2023. These will take place in 24 and 25. So by the time you get to 25, you're 6 months behind the baseline. And that is just ridiculous. I asked why. Why did you go to 2019? They said because it was a normal year. Hardly a normal year. hardly a normal year when we consider that we had the pandemic. We are now in the post-pandemic economy, and they cannot survive. I mean, like I said, 65% of the crisis response beds in the community are going to be shut down. Our community mental health crisis center has been closed down for years now. So no, 100% is what they need, and that's what the Democrats are going to work on with the cost of living increase. They're already behind by basing it on 2019.
Yeah, and I think we've seen it across the governor's proposal and then what Republicans have done where what they're proposing doesn't meet the scale of the challenge or the need in multiple areas. And we've talked about that with you guys before. And this is one example of that, where it's just, we know, we have the answer. We invested in the study, and then we're going to come in and not meet the scale that we need to. It's unacceptable.
I think it's really a good example and a stark contrast between our priorities, which are helping out folks that need the help, working people that need the help, our elderly, and the governor, in the meantime, is offering over $500 million of tax cuts that primarily benefit the wealthy. And we can't find the money to support full reimbursement. I would suggest go talk to the providers. If you want to know why 80% isn't good enough, go talk to them, because they can't cover their costs. And they will not be able to provide the services if we can't fully reimburse them. And that's the example that was just presented by Representative Caferro.
Shirley and then Jonathan.
I have another question about Section B. The proposal to add money to the Best Beginning Scholarship failed, and then Representative Howell's bill to expand eligibility failed. It sounds like Representative Howell may be working on another proposal, but I know there are other couple childcare bills working through the session, but I'm just curious if you guys can give us an idea of if we'll see any kind of makeup for what's
Yeah, so do you mind if I take this one?
No.
So Representative Buckley has a bill that I think that she introduced, but it has an appropriation in it, so we won't see it probably until after the general bill transmittal deadline. But what it does is it expands on what Representative Howell's bill did with a little bit more detail. We were surprised not to get a fiscal note on that, and so what we did is go in and create the appropriation so that we can see, how many folks it would cover. Right now, childcare availability is one of the biggest issues for small businesses and families, like all across the state. And so we do not want to leave this building without doing something that increases availability, stabilizes those small businesses, because you're talking about small businesses that are typically female-owned that are really struggling because of the way we finance. So what we want to do is avoid the cut that happened January 1st with Best Beginnings. The eligibility actually got cut, it got lower. So we want to reinstate that. We want to stabilize the way that we reimburse these small businesses for those slots so that they have predictability. What we hear from businesses every day is predictability is so important for us, and this bill does that, and then we appropriate the money for it. And we based all of that on what the director said to Representative Caferro's questions. It feels like 7 years ago, but it was probably 3 weeks ago. In Section B, Subcommittee, we took those answers and put them in the Alice's bill. So we'll see a hearing on that, I think, after transmittal. It has bipartisan support. She has bipartisan co-sponsors on it, and we're excited to continue the discussion.
We did put some funding in childcare in Section B.
Remind me.
I had a motion for $600,000 a year,
Okay.
and then Representative Gillette had a motion to tie down some money for an investment in childcare.
Okay. Gotcha.
And also home visiting.
Oh, right.
So
Okay.
those were a couple of good things.
Yeah.
Cool.
Yeah.
I mean, our committee got along just fine, and our chair did a nice job of running the committee. But this goes beyond relations. It's our relationship with the public that matters the most.
Jonathan?
Yes, for Representative Caferro, Forgive me, do you know off the top of your head how much difference there was between on provider rate, the motion that you brought and what was eventually adopted? How much?
12 million a year.
Okay, 12 million a year.
Mhm.
And you said that, as you see it, the Guidehouse study is already out of date or behind where it needs to be. So how much of a difference do you think it would make for providers if like, even if it went to full, you say that still probably wouldn't be enough to get them where they need to be. So how much of a difference do you think that amount would have made?
I don't know the amount, but I know that when the department cites 2025, they're 6 years out of date, because it was based on 2019. That's when the study was conducted, and they spent millions of dollars to do that. And every time Democrats tried to raise provider rates or get money into workers' pockets, the department kept saying, we need data, we need data, we need data. Well, we got data, and we spent a lot of money to get it, and now they're ignoring it. So.
Any other questions?
I had a question about Senate Bill 296, and that one is about like the senior care stabilization concept. That's like ringing a bell. The Senator Beard's bill.
Oh.
And it looked like that had a lot of bipartisan
Yeah.
support as well, and I was just curious if that, like how far that goes in addressing any of your concerns as, like, thinking about the results of Section B.
That's a one-time only retroactive payment. And I don't know if this is wonky or not, but it doesn't go into the base, so it's not ongoing funding. And what we really, really need is our bill to pass, so that it brings providers current with ongoing funding for predictability and stability, so they can do the good work of caring for people. That's what's important. One other thing I was going to say about Section B is while the provider rates got increased, the caseload got reduced.
Yeah.
And so that's a huge cut, and it will end up cutting services. So they get paid more to do less.
Yeah, can you expand on that a little bit and talk about the behavioral health portion of that specifically? Like why the caseloads were reduced, at least per what the
Yeah, so
committee heard?
there's mental health, there's developmental disabilities, and there's foster care. So we're talking, again, children, abused and neglected children, that the Republicans, they voted for the reductions, and then when I tried to put money back in for foster care kids, they voted against that. And what we know is that the current level of funding is providing a barrier to services. These small businesses can't hire people to do the care. They can't pay the bills, and then people go without services. They have reduced services, and in some cases, as I pointed out, what's happening with Western Montana mental health, services are eliminated and providers have completely shut down. So and that's a problem. So let's solve problems. That's what Democrats are trying to do, is solve problems, not to put a budget forward based on an inadequate level of funding, and that's what the governor's budget did, and that's what the Republicans supported. Democrats did not.
The caseload reductions were based on estimates from the department, right, about fewer
Yeah.
people needing those services, though?
Well, no. Well, is that true? Do
I
fewer
don't
people
know.
need services? That's not true, and that's not accurate. It's a mathematical formula-based formula that does not take into account real-time problems that are happening in the community. To base your budget on what happened last year when things weren't working makes no sense. We have problems, and Democrats are here to solve them. They also could have asked for an increase to solve the problems. I mean, to say that it's okay to cut the budget for services because it's based on caseload is just like, it's a circular argument, and it doesn't work. We have so much money. This is an opportunity of a lifetime to solve a long-term problem. And in most cases, they chose not to in Section B.
It's hard to justify a downward caseload
Mhm.
adjustment. in
Even
these-
with the unwinding
Yep.
and the
Yep.
public health emergency.
Yeah,
and
I don't
foster
think that they
care.
made their case. Dietrich?
Just to kind of forward-looking, so subcommittees will wrap up. It sounds like HB2 will go in front of the full Appropriations Committee, House Appropriations, probably after transmittal. Do you have a sense yet for what we should be keeping an eye on there? Or is it too early to know what we should be watching as stuff goes in front of the full Appropriations Committee? Other than, of course, efforts to put more money in for Section B stuff.
And that's a good big question, and the reason I'm not answering it is too well is because we're not quite finished.
Right.
So once we completely finish with the budget, we'll huddle and we'll get together our list of priorities as Democrats, but in part we know housing, community services, nursing homes, childcare, and fair and equitable taxes.
Right. So it feels like part of the dynamic that we'll see and we'll continue to see is that there are a lot of big, $100 million plus ideas for spending various portions of the ongoing and one-time only surplus out there. And of course, more of those piled up than there's actually money for, as always. As you're thinking about those, what are the key pieces of, what are the key ideas out there that are in circulation that you're going to be fighting for?
So you're right. The amount of money that Republicans have proposed spending, I think when we get the status sheet, is going to be kind of eye-popping.
And you have some of those too.
I do, yeah. So we have.
You collectively.
Yeah. No, I think the Democrats have been really clear about what we want to do, what our top priorities are, and how we want to approach a generational opportunity with I think it'll be close to a $3 billion surplus. By the time we deal with HJ2, we want to put money into housing. We want to build housing, and we want to create a situation where communities can access funds to create guaranteed affordability, whether it's rentals or
and that's
or home
the
supply.
$500 billion fund that you have.
Yep.
Yeah.
Yep. And that number can move, like we're trying to meet the scale of the crisis. We want to expand childcare with ongoing funding so that businesses and families can access that. And, that has a price tag too, and we think it's worth it. We have Mary's provider rate bill to address, a serious situation that is causing people to lose care. We want to fully fund education. We've always been in support of that. We want to fund the pay plan. I think if you look at the present law adjustment that we need in the budget, it's $380 million, right?
I'm sorry, I don't remember offhand, but if you say so.
So
you're
the
probably right.
present law adjustment, that is a bunch of words that I should understand. But don't
Oh, yeah,
understand fully.
no, totally. So that, all that means is making an adjustment to carry on the services that we are doing right now.
Okay, so that the people of the state should see the same services
Exactly.
that they've been used to seeing before.
Yep,
Yeah.
so that's the starting point. And from there, we have an incredible opportunity to invest in our communities and solve some problems. And, you guys all have our platform.
Yeah.
That's still what we're fighting for.
So the $380 million present law adjustment, that's money in HB2?
Yeah.
And that's the amount of money that needs to be added to HB2 to account for inflationary increases and rising,
Yep.
higher wages?
To maintain the current level of services for Montanans.
And does that include the money for the state employee pay plan?
Yes.
Okay.
But the providers don't get a present law adjustment.
Right.
Because it's privatized.
Oh, I would say that that's not accurate. They should have a present law adjustment, and that's why we put one in our bill, is cost of living adjustment.
Mhm.
And it's important because they are providing the services for the people of Montana. And that's our responsibility to make sure that they are paid. I mean, people who do this work should not have to sacrifice their own health and well-being and that of their families in order to do it, and plenty of them are making those sacrifices.
I think
Property
the-
tax.
Yeah, I think the other thing I'd add too is we have proposed saving some of the surplus, and creating a permanent trust out of that, and being able to distribute the interest off that account indefinitely. And we think that's a solid idea. We think, as it's been referenced before, this is a once-in-a-lifetime surplus, and we shouldn't spend it all, commit it all in the next 2 to 4 years. Something should be left to
Yeah.
generations down the road. So we're working on that proposal as well.
Is that the Ryan Lynch bill that's floating around?
Yes,
Okay.
the future fund.
Well, Ryan's bill is simpler than the future fund.
Yeah, Ryan's is just put $2
Yeah,
billion
yeah,
into the
yeah.
coal trust, but it's the same concept.
Yep.
Yeah, it's a trust, even if it's
Yeah.
a different, even if it's a
Exactly.
different
Right,
trust.
Yeah.
exactly.
We're gonna see something, property tax. Or, I mean,
Oh,
tax.
I was just like, what else are we willing to spend money on? And it's property tax.
Property.
Permanent property tax.
Yeah.
And you like the circuit breaker model?
Yeah.
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 One thing to note is that this surplus was created by Montanans, and that's why the money should be given back to them in a way that is long-term and also springboard for the economy.
Yep.
You know, there are plenty of people who the first thing they pay is their child care bill above everything else, because without child care, you don't go to work.
Yep.
So, least we can do is provide that infrastructure to keep the economy rolling.
Anybody have another one? All right. I'm reminded why we do these in Zoom. It's hot in here. But thanks
Thank
for
you.
coming. It's fun to see you guys.
Thanks.
And that forces us to take turns asking questions.